As we think about mind, body, spirit, fitness, we want to think about it in terms of wellness, the total person, understanding everything that we are made up of from the inside out. So exercise isn't just about getting in a workout and looking good on the outside. It's about everything from the inside out, the intellectual, the social, the spiritual, mental, and physical dimensions of what we're made up of. So when we think about this, especially early on in sobriety, we are given lots of choices. And one of those choices is to look at achieving our optimal health. How healthy would we like to become? That choice requires something of us. Requires of us a clean and sober lifestyle. Everything that we do, feel, think, and believe plays an impact on our state of health. Let's repeat that. Everything that we do, feel, think, and believe plays a huge impact on our state of health. So we're making healthier choices, understanding that it requires of us a clean and sober lifestyle if we want to achieve our highest potential for well-being. Giving ourselves time, being compassionate to our bodies, engaging our body from the inside out, mind, body, spirit, working towards and moving into the direction of having just a simple acceptance of ourselves, and maybe even a loving acceptance over time. So we recognize where we were in our addiction, where we are now in our sobriety, and where we would like to be in long-term recovery. Connecting this with exercise is simple. We need to tell our mind, exercise is good for us. It is a positive coping skill for our sobriety. And so because of that, we're going to engage our body. We're going to believe that. We're going to get up. We're going to move our body in ways that are healthy and balanced. And at the end of that, we're going to recognize how much better we physically feel, but more importantly, how much better our spirit feels. Because we are moving in the direction of optimal health, taking responsibility for the body that we're living in. Because everything that we do today, in terms of taking care of ourselves, is going to impact the way that we're able to live tomorrow. Exercise is extremely important to our sobriety and long-term recovery. It's not that we're using exercise as a way of helping ourselves get sober, but we are engaging in exercise as a positive coping skill for our sobriety and long-term recovery. Early on in sobriety, cardiovascular exercise, 30 minutes a day, is a great release in terms of dealing with depression, helping us lift our mood, anxiety and stress, giving ourselves a break, taking a time out from the day-to-day stressors, and just being able to focus on physically moving. Self-esteem, boosting our self-esteem, feeling good because we're actually engaging in being responsible for our own health. So when we think about exercise, we want to think about cardiovascular exercise. We want to think about flexibility. We want to think about strength training. All of those things together build a very balanced exercise program. Important that we're doing things that we enjoy doing, things that help us physically feel good. Because if we're doing that, it's going to help us engage in that even more so, and we're going to want to continue with that. Connecting that back to wellness. Exercise, a very positive coping skill for our sobriety. And for those of you that are exercising, you know what it does. It simply just makes us physically feel better. And who doesn't want to feel physically better? So we engage, we structure it, it's part of our routine, it's part of our day. It's not something we do if we have time left over, but it has direct value for our sobriety and for our long-term recovery.